want any more promises. We just want the vaccines. A month ago, I called for a global moratorium on booster doses at least until the end of September, to prioritize vaccinating the most at-risk people around the world who are yet to receive their first dose. There has been little change in the global situation since then. So today, I'm calling for an extension of the moratorium until at least the end of the year, to enable every country to vaccinate at least 40% of its population.
Dr. Emanuele Capobianco is the head of health and care at the International Federation of Red Cross and Red Crescent Societies, and he's joining us now from Geneva. Thank you for joining us, Doctor. The appeal from the WHO seems to be falling on deaf ears. No one is listening.
Yes, and this is a big problem because a huge part of the world is without COVID vaccines when a limited part of the rich world is moving ahead with the third dose. This is not only unethical when there are doctors and nurses and people at risk in low-income countries that are dying because of vaccines, is also not good science because we know that the people who have 2 doses are well covered and protected from getting the serious disease and from dying. So those precious doses needs really to be directed towards countries, low-income countries, and then countries in humanitarian situations.
And if the world really wants to reduce the global risk from COVID-19, does it not make good sense to try and make sure most of the globe is vaccinated against COVID-19?
Absolutely. There is a moral argument, there is a public health argument in making sure that doses are prioritized now for low-income countries. Because if this doesn't happen, the risk of the emergence of new variants of the virus, it gets higher and higher. And those variants may come back to hit those rich countries that are now protecting themselves, but would become potentially very vulnerable to variants that can escape vaccines.
Now, that sounds like a very sensible scientific warning to the global north, as it were, to say, why not help? Is there monitoring that the medical experts can do around the world to try and keep an eye on what variants are being created?
Yes, there is a very close monitoring on the variants that are circulating. And then for the time being, the good news is that vaccines are effective at protecting people from getting a serious disease and from dying. So at the moment, the efforts of every organizations like the Red Cross and the World Health Organization is really pushing vaccines towards the arms of people in need, starting for the people that are most vulnerable. As you said, the world has not been listening to this, particularly the leaders, and I think we need renewed solidarity. We need a spirit of humanity to bring this together, because at the end of the day, a pandemic is ended only when everyone unites and the spread of the virus is stopped in all countries of the world.
Emanuele Capobianco, thank you very much indeed.